Meeting of the Board of Health to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I am Gail Demore, Madam Chair, and with me are Vice Chair Mary Beth Welch and board members Dr. Ed Weiner, Andrea Sheehan, and Dr. Marwa El-Sahabi. In addition, our professional staff is here alongside us. We have Susan Luminello, Director of Public Health, Michael Green, Associate Director of Public Health, and Christine Mathis, Environmental Engineer. Also we have Miss Julie Fockingham online, who is our recording secretary. Thank you for all the hard work that you guys do. Please note, we are online and will be taped by BCAT and are available for appropriate comments and questions throughout this technology. Thank you to BCAT for all that you do for this community, which is keeping us so well informed. Let's see here. I think we have approval of 2 sets of minutes, October 14th. Does anyone have any questions about those minutes?
I do. The October 28th minutes, I think it might have been an old template because it references the chair is Ed Weimer and the vice chair is Gail Demore, so I just think that needs to be changed.
Okay, Julie, did you get that?
Good catch.
The 28th minutes?
Yes.
Oh, yeah, I see
28th.
that. You're right.
The first ones. are
Yeah,
fine.
good catch.
It's probably the old template.
It wasn't like that on the other one, so was it?
No, it was not.
So,
I'll fix that, thank you. Can you hear me?
Great,
I can't.
good catch.
Okay.
Okay, so I need a motion for October 14th minutes.
So moved.
second.
As corrected. Correct, Madam Chair? As
Well, the
corrected.
28th, are you talking about the 28th or the 14th?
Four-
You said the 14th.
The
Yeah.
14th, I'm sorry.
Actually,
That's right.
you're abstaining. I think you weren't here.
Yeah, truthfully, you can still.
Oh,
But
okay.
I'll
All right, I
abstain.
didn't
Nope,
realize that.
No, if you, from the
Is that
open
the
meeting
normal
law, it says
protocol?
you can, but I'll abstain. Nope.
Is that the normal protocol?
No, I'll abstain.
I'm just learning.
Fine, I'll
Okay.
abstain, because we typically do.
So
but
for October 14th meeting minutes, all in favor?
Aye.
Abstain.
And then October 28th minutes, all in favor, with the correction. Thank
Correct.
you for bringing that to our attention. All in favor?
Aye.
Aye.
Okay, good. So we have citizens' time. Is anyone online? There's no one here in the audience today. That is not part of our agenda. No one's here. Okay. So a quick chairman's report. This year is certainly flying by and right in our face with some of our agenda items. We're moving on to next year with our Board of Health schedule and our budget right in front of us. Lots to look forward to, especially all the good hard work that the health department does right here in Burlington for all our residents. So thank you for all the hard work that you guys do, and also to the board members who work hours reading things over for our meetings. It is all greatly appreciated. I'm looking forward to the new year, and my hope and wish for everyone is to have a happy, healthy holiday season, and we'll see what it brings. We have 2 subcommittee reports tonight. One is updates in public health by Dr. Ed Weiner.
Yes, my turn. This time. Usually it's. This one's a little different. Recently, my best friend of 6 decades passed away. He lived alone in New York, and for some still unknown reason, he collapsed in his home, only to be found 24 hours later because I asked for a wellness check from his neighbors who had a key to his house. He spent a month in a coma before dying. This terrible story should serve as a wake-up call for anybody who lives alone or anyone that you know, a relative, family, friend, who may live alone by themselves. Here are a few things to think about. If you're alone, and the same for a loved one who may be living alone, somebody always needs to know where you are and that you're well. You should consider an emergency device that can alert services to notify someone if you need help. And what I call an access plan. Someone or someones should have a key or code to their residence or your residence so they can check on you if necessary. On your refrigerator or someplace very visible, everyone should keep a list of emergency contact numbers and your medication list, and maybe your healthcare proxy and possibly your living will. You may even consider creating a power of attorney. We'll talk more about those documents in part 2 in a future meeting. Now, I'm not an expert, but these are a few of my basics that I'm working on myself with my wife. We should do these things when we're well. Hopefully, we'll be well for a very long time. But just in case, if there's an emergency, we know, too, we should make things easier for not only ourselves, but for our loved ones who try to help. The Burlington Board of Health is always a phone call away if you have questions, and sometimes we have some things that will help you make some of these decisions and help put some of these documents together. Thank you.
Great suggestions.
Thank you.
Thank you. The second subcommittee was just the Burlington Wellness Committee, where Dr. Marwa Shahabi and myself are both present at the last meeting on November 19th. We primarily spent our time evaluating the current wellness policy and dove into how it's being implemented and took a look at things that might need to be improved upon. And I think our next meeting is next week. Yeah. Okay, good.
Can I ask
Yeah.
a question? The wellness committee, is that across boards, or is that just internal that you have this with the Board of Health?
The Wellness Committee is tied into the school committee.
Okay, so I thought,
And
but I
it's a
didn't know if you
larger
have-
scope. It is, I believe, a mandate through the state with public schools, but also they were looking for certain criteria for certain members. So like they needed someone from the board, they were looking for a doctor. There's many parents, representatives from each school, as well as,
For teachers.
yeah, teachers and like staff, administration,
Is it-
and school committee.
Is it just board or staff members?
I don't think it's based on like boards, so
Yeah.
there is other departments that are on it, like the Youth and Family Services.
Correct.
Okay,
and
yeah.
It's community
I-
members.
I
Anyone
just-
who has a state.
I'm familiar with it, I just wasn't sure if that's the one you were talking about, thank you.
Yeah.
Or if it was just something.
I think
that
it's
you and
grown.
Mara can-
Yeah,
just with the
no.
board.
No,
Okay,
I think it was-
regulations outline it too, I think.
Yeah, I think it's grown and kind of, it's more formalized than it used to be.
Okay.
Because it's been, the Wellness Committee's been around for a long time.
Yep, I remember,
Yeah.
thanks.
Lisa
Yeah.
Chen has just kind of extended it, wanted to do some outreach into the community and have more people involved.
The
Yeah.
new associate,
Principal, I think.
Principal.
Yeah,
is it the principal? Okay, I thought it was the superintendent, it's the associate
Yeah.
principal.
And I've always been a part of the wellness committee.
Yeah, that's what I was
just
gonna
yeah,
ask.
Just so you know.
yes,
Yeah.
but it's
Yeah.
grown.
And now
There's
yeah,
like a ton of people.
more Participation.
Thanks.
Yeah.
Thank you.
Onto our agenda here, we are going right into discussions. We have 3 things listed. The 2026 Board of Health meeting schedule. Does anyone have any questions or comments or issues with the dates that are listed? Is there anything that's glaring?
This is a discussion, so it wasn't a subcommittee that formed the calendar outside of the town calendar? This is just.
So
specific
we
to
base
Board
it
of
on the
Health.
second and fourth Tuesday of the month, and Sarah in our office puts it together and looks
Okay.
at.
It's
you
not
know,
a subcommittee.
Potential holidays or.
Okay.
So we just need you to vote on
I
it.
Vote on
approve
it?
The schedule, yeah.
Yeah, I
Okay.
move that we approve the proposed meeting schedule for 2026.
Do I have a second?
I'll second.
All in favor?
Aye.
Aye.
Aye. Great. The second discussion item was the fiscal year 2027 Board of Health budget.
Yes.
Did you want to give an overview or?
Yeah, I have
Susan and-
a
Your slideshow was
presentation.
nice. Yeah, it looks great.
So let me just bring it up here, hold on. Oops. Okay, so this is a little bit earlier than I normally do it, because the administration asked that we do it earlier. Usually I'll do it in like January
Okay.
for the May town meeting, but they wanted it by the end of December, so that's why I'm bringing it to this
Okay.
meeting. Okay. So for the overview, in the budget itself is in your materials, so the actual budget that will be in the meetings for town meeting is in the materials. So the proposed budget has a 4.48 increase, with 4.6 increase in salaries and 0% in expenses. However, we do have a 4.92 increase in special accounts, and that's because of hazardous waste, and I'm going to go over that.
Okay.
So for our estimation of our fiscal year 27 household hazardous waste costs, we did raise the cost for hazardous waste in the next fiscal year, and we did an estimation of what we think it's going to cost for next fiscal year. So we took the total number of cars and averaged them over fiscal year 21 to 25. We took the total propane tanks and fire extinguishers collection and took an average of that for those years. Total cost for sharps disposal, average, and then we use those averages and we use to estimate the cost, the fiscal year 27 cost using Clean Harbors rates. So they're on the state, we use the state bid list, which to get these costs, and it changed. And Clean Harbors is the lowest rate on the state bid list right now. And the bid, and so we took those rates to estimate for fiscal year 27. So this is what the estimates came out as. So as you can see, this is the total number of cars for each fiscal year. So we took full cars, half cars, small cars, and then at the top there is the total cars. So this is what we've had over the years. It looks like since fiscal year 21, our total cars have gone down a little bit. And then this is what was averaged. For the total propane tanks and fire extinguishers, this is what we got for the averages, for each fiscal year for those. Now, the prices differ depending upon the size of the tanks. So we did it for 1 pound, 5 pound, 20 pound, 30 pound tanks, and then fire extinguishers. This is the sharps disposal program. So our program includes disposal of sharps at the kiosk, the fire department.
Okay.
And then we also give out the free sharps containers at the Board of Health office. The reason why we do that is because the containers need to be small. And so we want to make sure that people don't jam up the kiosk by putting in inappropriate containers or loose needles or anything like that. So we have the free container program so people can come pick up the containers and then dispose of them when they're full. So this is the estimated cost that we have on average. I'm just gonna, okay. So as you can see, we took the fall event and the spring event, took the average full cars, and you see the full car costs. Total, so this is the total, subtotals are at the bottom. So the subtotal for the total full cars is approximately 24,000. So we did that for half cars, small cars. Then I took the propane tanks, took the average of those, and then the cost to dispose of those according to Clean Harbors. So and then the fire extinguishers. And then we have a one-time cost on each event of things like custodians and setup fees. Then at the bottom there is just the average of the medical waste costs. So taking all those into account, the total projected cost for HHW for fiscal year '27 is $56,000. Our current budget is $50,000. So I raised it to $55,000 for a couple reasons. One being, this is based on average costs. Two being, we currently use a propane person who takes the propane tanks and the fire extinguishers. This is based on that they're not going to be available. So it's a little bit more conservative, I think, because, I mean, hopefully we'll be able to use them in the next fiscal year, and it's not going to cost as much as this.
Okay.
You know.
Just a quick question,
Yeah.
Susan.
Oh, that's it, so,
Oh.
Yep.
I mean, since I've been on the board, it's always been twice a year, but was it established as twice a year, the hazard health day?
yeah, since I've been here, it's always been
Always
twice a
been
year.
twice
I
a
mean,
year.
that's up to the board, I don't, yeah.
We, for the first 3 years, of my tenure on the board, I think it was 3 years, we had it once a year. And in those days, we poured oil too. There was just so much, it's overwhelming. It's overwhelming how much. This year, as a comment, I haven't missed a household hazardous waste in, I don't know, I've been to 60 of them or so. And we are still getting some extremely bizarre chemicals. The last time we got DDT, in fact, I took pictures of DDT. It's been outlawed, Christine, for about how many years?
50?
50 years, and we're still getting DDT, and we're getting chlordane, and we're getting chemicals that clearly do not belong in Burlington. And lastly, as we see more and more renovations and more redevelopment in this community, people are cleaning out these old houses, and you can't believe what's in them. So the $55,000 is a bargain for what this board does for the community to get rid of those very toxic chemicals. I think you should go higher than 55,000, so we don't have to go for a reserve fund transfer. Since we're ballparking it, I think we should go to 60,000. And if we don't use it up, we can always give it back. It's a lot easier than a reserve fund transfer, which I would not know what would do if we didn't get a reserve fund transfer and we did go into the $58,000, $59,000 range. So that's just a comment that I have. And yeah, it's been 35 years. We've done it twice a year.
Have you gone over budget recently? or
No,
anything? You've
I
been
never
pretty
have.
spot on.
Never have. Okay. And I rely on your wisdom.
And are you overestimating with the propane tanks?
Yeah,
Because
that's,
we know we have a certain price there, and if they were to go away, we'd have to accommodate that.
yeah, this is based on if they were to go away.
Okay.
Because the Clean Harbor rates for propane tanks and fire extinguishers is a lot higher.
Much higher,
Than
yeah.
what we're using now. I
Okay.
will say, there's not many alternatives.
Right.
For propane tanks and fire extinguishers. Like, we probably, if that company did go away, we probably would have to use Clean Harbors and do the
Right.
collection, where the cars are.
Okay.
Yeah. I didn't want to add anything.
I was just going to say that the total number of cars is also a little bit conservative as well, because we have a huge, like the biggest HHW numbers we ever had, which was like the one we had after the shutdown during COVID.
Yeah.
And we had just record numbers. So, it's got a very high number in there, skewing it a little bit, but
Well, also depends
Yeah.
who's doing the clicker.
no, I'm strict about the clicker.
You're good about the clicking.
So, yeah, because fiscal year '21, if from this graph, you can see we had, over 450 or so
Yeah.
cars.
That one
in
event
year.
was-
And
That
then,
was
what
huge.
was it?
Yeah.
Fiscal year '25, if we base it just on that, because I did include the last 5 years and not the last
Right.
3 years.
Right.
It was 250 or so, looks like. for full cars, you know.
Madam Chair, we didn't include here light bulbs or batteries. Do you want to comment on that?
Yeah,
that's a good
those we do not pay for, right? Because we have,
Okay.
who is it now that takes those?
So the batteries, it's Interstate Battery. They come, they staff it, collect it, and recycle them. And actually, the DPW pays for the disposal of the light bulbs.
Okay,
What you should also know is that the state bid list is only for fiscal year '27. So we could be here again next year, and the prices have gone up again. So
Okay.
we can only say this for 1 year. We can't, we may be back here next year and say the prices have gone up, because how many people on the state bid list now? Two?
There's
not a whole lot of There's not a whole lot of companies still doing this, correct?
Yeah, so they used to do 5-year
The costume.
statewide contracts. This one was 2 1-year statewide contracts, one for FY '26 and one for FY '27. And there was an increase from '26 to '27. The numbers are just going up across the board, so.
Okay.
As Susan said, nobody knows what's going to happen for FY '28.
right.
And the speculation is that, I think you told me this, someone had told you that, they don't make much money coming to these events.
No.
So that's why there's not many on the state bid list.
Okay.
They make more money doing other types of
Types of
disposal.
things, okay. What about, and I'm just thinking outside the box to explore in the future, where we have a tri-con group, what does Wilmington do? What does Lexington do? Have we ever thought about partnering, or is that
So-
not
so
even
Lex-
feasible? It's just something to think about.
Lexington has a stationary facility that's open 7 months of the year, 1 weekend, 7 times a year, and they have member towns. So for example, I live in Bedford, and Bedford's a member town, so you just contact your local Board of Health, and they count you in and give a number to Lexington.
Okay,
And it's actually very convenient, because you have 7 opportunities to go.
yeah,
I did contact the Lexington DPW director who runs that program. I asked him the last time I had talked to him about it, just doing research, he said they weren't accepting new communities, but when I called him this time, he said that we should talk more. And he wants to talk after the first of the year. So I'm just going to explore what that might look like, and what the cost structure would be for Burlington joining. Beyond Lexington, the next closest stationary facility is Devon's, and that's that's 50 minutes, 55 minutes, so I don't think that would be of interest to Burlington residents. Wilmington, I think, holds 1 a year, but I don't know that they do it consistently, so I could check on that. But I'm just collecting current information from Lexington on their stationary facility. And it's actually fairly convenient. It's on Hartwell Ave, which is right off 128. If you,
Okay.
you could, you
Yeah.
can just go 62 and jump over. It'd probably be like a 10-minute ride for most
it's
Burlington
something
residents.
worth exploring.
But yeah, just to
I think,
get
Just to be
info.
prepared for the
Yeah.
future, because we don't know.
Yeah, because as Susan said, the numbers could go up for FY '28, and then '29.
Yeah, when you corner the market, you can do what you want, kind of, so, something just to think about.
I have a quick question. So I know it's called household hazardous waste, but are there any companies who bring in, this is all just strictly household items?
Yeah, they're not allowed.
They're not
So
allowed to.
we're stopping them at the,
Yeah.
if we see someone, it looks like they have so much stuff that it comes from a company or a
Or
contractor.
like a business or something?
tell
They should,
them they
they
need to
should
leave.
pay themselves to do
Yeah.
that.
Yeah.
Hopefully they are.
Exactly.
Yeah. And is it a lot of, what you're seeing is a lot of homes being kind of renovated, or like where is
I think
Everything,
Yeah, it's a-
everything. Over the years, we've had everything from DDT and all kinds of pesticides to
Oh, yeah.
people who had home laboratories, to people who, I think once we had that one story about that, they Karari-tipped arrows, and that,
Oh, yeah.
we ended up donating to some. Anyway, bottom line is, we've had so many crazy things come through
It's
that.
true.
Come through that. And we do our best to keep it the way it is, you know. People are very, very complimentary. I think all of us have been there, and people say, oh my gosh, they're so happy to get rid of this stuff.
Yeah.
Because,
If you let them through and they're not from another town.
Well, that's,
you know, and you know what? We've had so many instances where people found things by the side of the road, even in Burlington.
Oh, wow.
Yeah.
You know, I know that our environmental engineer has dealt with that in the past. People just, I'm afraid if we didn't do this, it'd be all over the place. I'll, you know, ask my.
well, I feel like we should do it, yeah.
Oh, no, we
Yeah,
gotta do
we
it,
have to.
I mean, you know. And we give the organic organic fertilizers to the Burlington farm, Burlington Grove.
Community garden, yeah.
Community garden, thank you.
If we didn't have it, there really would be no options for
Exactly.
people,
Probably no alternative.
because.
Right, like what else are people gonna do?
Because we've talked and tried to figure out, okay, well, what do people do in between?
What do you think they were
our
doing
elections?
before? Right.
You know,
Um.
it's like, because some people like, well, I have to clean out the house now, but all we can say is, you know, you can hold it until,
Yeah.
you know, we have our event, or we have options to call, like.
There's one's in Braintree and one,
No, I wasn't questioning.
one's in Sutton, yeah.
That we shouldn't continue. I was just asking.
No, I know.
About the twice a year, but it sounds like it's working and you've
Yeah,
got,
no, I
you've got
just-
the attendance and the stats to prove it, so.
Right.
Yeah, I just was,
Oh, sorry.
yeah, my
Yeah.
point being that, that I can see why people from other towns,
Yeah.
like, come, because
Correct.
try to get through.
Right.
Because there isn't a lot of, when they call, like, we're at a loss to tell them what to do. Like,
Yeah.
we just had a call recently that I happened to take, and, you know, they were moving, and they had the stuff, and they need to get rid of it now. And I said, well, we have a couple places on our website. Oh, I already tried calling them, it's too expensive, or they can't take it, or whatever.
Right.
They don't take those small amounts, you know?
Right, that's the tricky part.
Yeah, and if you have to drive your stuff to them, one's in Sutton, it's like an hour away, the other one's in Braintree, which,
Not.
yeah, those aren't great
just
options,
not
you
gonna
know.
be-
Not great.
And they have limited hours, and then if you attempt to have them do a pickup, it's just prohibitively expensive, you know, so there's very few options.
Any other questions?
Yeah.
Okay, so I'll just need a
Do we
vote
need
on
to
the
approve
budget.
on the-
Yeah,
Okay.
and then, so the next step would be voting on the budget, and then in around March, the Ways and Means meeting will happen. I'll let you know when I get the
Sure.
schedule for that. And then it goes to town meeting in May.
Okay. So I need a motion to approve the fiscal year 2027 Board of Health budget.
So moved.
Second?
All in favor?
Aye.
Aye. Okay. We have one more thing left to go over. Our Associate Health Director is presenting on vaccine for children overview. Michael?
Yes, thank you, Madam Chair. So in 1989 through 1991, the U.S. experienced a rather large measles epidemic that resulted in tens of thousands of cases of measles and hundreds of deaths. Public health historians attribute the measles outbreak to federal funding cuts to immunization programs. Children who relied on public health clinics for immunizations were not receiving the vaccines. In 1993, the VFC program was created as a result. At that time, the recommendation was for a single vaccination. Following the creation of the VFC program, the MMR second dose became required, which increased vaccine effectiveness from 93% to 97%. VFC eligibility includes all of the following requirements and that the child be seen at a federally qualified community health center. If you notice, Medicare eligible, this program can also be selected if they're in Mass Health or Medicaid as their secondary insurance. Burlington initially enrolled in the Vaccines for Children program on February 4th, 2005. Programs require a medical director who is registered with the Board of Medicine in Massachusetts and is willing to sign standing orders for each vaccine and oversee the program. Currently, it is our board member, Dr. Marwa El Sabahi. Vaccine coordinator is our public health nurse, Sandy Trioni, and our backup coordinator is Susan Luminello, our director. Pharmaceutical-grade standalone refrigerators and standalone freezers are required, as is a backup generator. We even need signs on the wall outlets and circuit breakers warning, do not unplug and do not disconnect. We must enroll annually and be subject to the state audits, which are usually every 12 to 24 months. The vaccine coordinator and the backup coordinator need to complete annual vaccine program storage and handling training to maintain enrollment in the program. They must also review and update all SOPs annually or when changes to the procedures or staff occurs. Temperature records need to be reviewed twice daily to ensure temperatures are in range. Vaccine stock must be rotated. Unused vaccines should be transferred to another pediatric provider 3 months prior to expiration so that they can be used. And a memorandum of understanding with Leahy Hospital Pharmacy for backup emergency storage is required. So the process with the schools, so the school nurses will send over referral forms and the historical vaccine records to the public health nurse after their initial review. Our public health nurse will review the records and enter the information into the Massachusetts Immunization Information System, or MIIS, to determine what vaccines are required. MIIS is a confidential web-based immunization registry that collects and stores vaccination records in Massachusetts. It also maintains our vaccine inventory records. Some children do not receive vaccinations when they're younger, or they were not recorded. The public health nurse uses the catch-up immunization schedules to determine vaccine requirements. Historically, the vaccine program was used only for initial vaccinations, but now, because more students do not have an established pediatrician, families are returning to the Board of Health to complete the vaccination series. So here you'll see a chart. Burlington dispensed 433 vaccines for children vaccines doses in 2023-2024, and we were down to 249 doses in 2024-2025. The Burlington Volunteer Reserve Medical Corps assisted greatly during these vaccine clinics. In 2020-2021, we administered 1.78 vaccines per student compared to 2024-2025, when we administered almost double 3.6 vaccines per student. Students are returning to the Board of Health under the VFC program to receive these second and third doses in a series. As you can see from this graph on the percentage of students by age range, the green trend line shows that from 2020 to 2024, the change in percentage of students in the 3 to 10-year-old category is trending down, versus the change in percentage of students in the 16 to 18-year-old category, shown as the red trend line, which is trending up. So we are seeing more older students than younger ones. In conclusion, the CDC estimates that among children born from 1994 to 2024, routine childhood vaccinations will have prevented approximately 508 million cases of illness, 32 million hospitalizations, and 1,129,000 deaths. They estimate that for every $1 spent on childhood vaccine, it saves between $3.30 and $10.90 in societal costs. In the past 5 years, the VFC program was most utilized in 2023 to 2024, and we have seen a downward trend last year.
Wow.
Any questions?
I do have a question. So do we anticipate not being able to get these vaccines as easily because of federal issues going on? I mean, even at my children's pediatrician, they don't get the vaccine as easily as before.
They don't get the what?
They don't get their vaccines as easily as before. There's delay, like, there was actually a delay in their shipment. This is to a practice related to a hospital.
We haven't heard anything
I'm
that,
just curious if
but
there's anything on the
we've had delays in the past, but we haven't had any delays lately. Sandy is still continuing to order them.
Yeah.
There
I mean, I
really
haven't
haven't
heard
been
of
any issues.
Yeah.
Yeah, I mean, in the past, over the years, sometimes depending on, if they have them available, it might be a couple weeks later than we thought. Especially when we were in the middle of that, really, when we've given out a lot of them, 23 to 24 here. It was taken a little while for certain vaccines, but, yeah, I haven't seen that, no.
And what's interesting also is that, like, we don't get any of the flu vaccines in our offices to give to patients now. And even at the pediatrician's office, they told me to go through CVS.
Yeah, I don't know why they do that.
They're just not being given the vaccines anymore. They're not being distributed to
Companies used to do it, like we'd
physicians'
have,
offices, yeah.
and I don't think they're not.
Yeah, there seems to be this push
Yeah.
for the pharmacies, and actually, we had a meeting with the state. So, the grant program, they're talking about, because there could be a cut in the grant funds, that look for additional ways to fund these types of things that we're doing under the grant, and they used the revolving account as a way. And I spoke up and I said, how can we use the revolving account? We're doing less flu vaccine. You're pushing people to the pharmacies to get flu vaccine, not to the local boards of health. If you want us to use those funds for doing public health work, then you need to have people come to us to get their flu vaccine, and they're not doing that. So I don't know, they really should be, instead of pushing it to pharmacies, pushing it to local
Just
board of
noticed
health,
this trend
to
in-
fund public health.
Right.
And
Right.
that's not, because the amount of money that we've been making that goes back off giving the flu vaccine on an administrative fee, goes back to public health programs.
Right.
We're not,
Right.
so we're not, and that has gone down significantly since we
Right.
haven't been giving as much flu as we used to. We used to give 500-600 doses of flu.
Wow.
I think we gave 200 and something.
We'd have
Right,
huge
we
flu clinics.
talked about that.
Yeah.
There's another silver lining in this, and not only do we have excellent professionals within the board, but we got to acknowledge that the MRC has played a terrific role in the administration of flu vaccine and we have even used them in some of these also in very, very rare cases. So we wonder, why do we need an MRC, and what is the MRC doing? And the MRC does tremendous work in this community, and I know that you have a major hand in that, Mr. Green, and I know that the buck stops with Susan, but the bottom line here is the MRC has become a vital part of the Board of Health and a vital part of this community. So if anybody's watching, thank you.
They helped a lot during that 23 to 24
Yeah.
year, because we didn't have a
Stepped up.
nurse.
Nurse.
Right,
Yeah.
it's true. It's true, they did a great job. Great presentation, thank you. Are there any other questions? Anything? So we can move on to our staff reports. And it looks like we're starting with Miss Christine Mathis, our environmental engineer. Overview on your staff report, please.
Just to highlight, the hazardous materials storage permit inspections have been completed. I usually do them between like end of April and December, so they're done for the year, about 100 of them.
Thank you.
Yeah, it's good to get them under the belt for the year. Any questions on the rest?
Did anyone?
Ms. Riley, I have one.
Yes, go ahead.
How could a company that does CGMP manufacturing and drug discovery and development have a complaint for noise complaints?
HVAC equipment on the roof,
That's all,
Oh,
okay.
interesting.
Thank you.
That
Thank you
makes
very
sense.
much.
compressors and that type of stuff, belts.
Thank you.
Any questions? Could I have a motion to approve environmental engineer Christine Mathis report.
So moved.
Second.
All in favor?
Aye.
Aye. Great, thank you. We're moving on to the Associate Director of Public Health, which, Michael Green, your staff report.
Yeah, Madam Chair, I just wanted to highlight our second quarter BVRC meeting. We had Dr. David Alper do a presentation on diabetes, foot care, and amputation prevention, and that was a wonderful presentation.
Great.
Very thankful for him to do that, and I believe I'll be leaning on him in the future to do other presentations for him, because I know now he's a great presenter and he's got a lot of material.
I've heard some good feedback. Thank you for putting that together. Does anyone else have questions?
First of all, he was more than 30 years on the Board of Health in another community.
Really?
Yeah. You also coordinated psychological first aid with Dr. Sham Khan, who was always magnificent, a favorite of mine, a professional presenter. Also, you coordinated Matter of Balance.
Actually, that was our public health nurse.
She did that, okay.
Yep, she's taken over that program. She's even trained the trainer.
And last Wednesday, you had another meeting.
Yeah, last Wednesday, we had our, what did we have?
Award.
Oh, that was our appreciation dinner,
Annual.
yeah.
So
Which
thank
was,
you for all those.
which was great. Didn't have any entertainment for that, but I don't think we needed any, because everyone was
There's
just
a lot of talk. a lot
networking,
of
chatting
networking,
away,
yeah.
I was
so.
away.
But I definitely appreciated Vice Chair Mary Beth being there, and
Mhm.
said a few nice words to the group, and
I
we had a
enjoyed it.
wonderful dinner.
Going to be going to the luncheon on Mondays. I'm looking forward to it.
The next one includes the application, the associated pages. Okay.
Yes, thank you. Okay, any other questions for Mr. Green? Great, I need a motion to approve.
So moved.
Second.
All in favor?
Aye.
Thank you, and we're moving on to the Director of Public Health. Susan Luminello's report will include the health agent Marlene Johnson's report, the Associate Health Inspector Samantha Ellsworth's report, and the supervisory nurse Sandra Troiano's report. That's a lot.
And the reports for the shared services staff.
Oh,
So I believe
correct.
there's two in here, which is the health inspector and the public health nurse. So we did hire a epidemiologist and a health communications person, and they started last week. We had interviews today for the health inspector position. It looked promising, and we're hoping to extend the offer to one of the candidates. I was joined with that by Alicia McCartan, the director in Lexington.
Great.
And Marlene also sat in that interview, so, yeah, so, I don't know if you have any questions on any of those. The public health nurse in the shared services office has been very busy. She did a community preparedness presentation today. She assists with, she's going with the CPR AED and the first aid. She's going to be looking at maternal and child health issues. And the health inspectors and the nurse, we're hoping to get some porting training in for them. So if we have any porting cases in the region, they can assist with those, because those tend to take a lot of time. And the health inspector's also been doing some housing and trash inspections lately as well.
Two questions.
Yeah.
First, a comment. You know, we have some excellent nursing under your direction, and people may think that they just handle the flu and some basic diseases, but they do handle some things which are very different, I will say. Not rare, but different, like Giardia and Chickenpox and Campylobacter and babesiosis, which is becoming more prevalent in the state. So I just want to thank you, because they're doing some interesting work, and not just what we would think a the couple of sneezes and the flu, but it's really. And then I needed to talk to you about the Triton Coalition letterhead.
Okay,
I just think that the coordinators, the people in charge of the program should be on the letterhead and not just the people who work there, the part-timers. And if you're the coordinator, maybe you coordinator, but I know that Kathleen is there as the administrative person, and there's a healthcare worker, and there's a I just think that the
Okay.
leadership should be on that letterhead, because the buck stops with the three of you.
yeah, we could put advisory board members on one side and then staff on the other. or
Maybe
something
that would be
If we can
fine.
fit them, we'll try to fit
That's a
them.
good
in.
idea.
Yeah,
But you know, your name should be there, because these are all part-timers.
yes, yeah.
Thank you.
Good idea. Any other questions or comments?
Can I ask one quick question as a follow-up
Yep.
to the issues of that extended stay?
That's what I was
I don't
Yes.
know whatever came with that.
The
Oh, good.
building inspector
Yeah,
went over and he sent an email. Did you see his email?
I don't know, I only had the initial email that you had CC'd me, you know, with his name on it.
I don't know if he gave the results of what happened, but he said he was gonna look into it.
Okay.
That's
I was
Marty.
just curious to know that.
Yeah, I can see if I can find the email real quick.
Okay.
I thought he put that he was gonna,
I don't think I got anything. I
all
might
right,
be
let me
mistaken,
look
but
and
I don't
I'll
think
let you know.
Thank you very much.
Yeah. If not, if I don't have it, I can always ask him if it's got,
Just
you know,
curious.
what the
Yeah.
resolution
Yeah.
was.
Thank you very much.
Yeah.
Any update on the pest control over at Lord Barron?
So he came in this week and gave us all of the rest, he's continuing to do the pest control out there. I haven't gotten any more calls from the neighbors, like of sightings. They have seeing less activity. I think we can kind of close that one out for now. Hopefully they won't see any more activity,
Right.
you know, but they've been doing a really good job. They got all the dumpsters switched out.
Good.
Okay.
So, you know, new dumpsters, making sure, you know, it's an ongoing battle, making sure people keep them closed and
Yeah.
everything. But he is continuing with the pest control and everything, so
Great.
I was thinking I could probably lay off that one a little bit and, you know, not the constant inspections. And hopefully, you know, the issue is resolved, and, because we really haven't heard from the neighbors. I haven't heard from them in quite some time.
That's great.
One more
That's
question.
good news.
We are going to participate in the
Oh,
municipal
that's right.
The civic fair or?
fair, we
yes.
always do.
Yes.
Yep, so the public health, we were asked to do flu vaccine, so we have a small number left. I think she's got like 11. So she's gonna do flu vaccine. Sandy will be going with Rebecca, the two nurses, and they're gonna represent the board, bring all our materials, and give out the flu vaccine to anyone who wants it.
And what
Until
about
it's
the Board
gone.
of- other Board of Health activities? We always get lots of questions.
We have a pamphlet on like the Board of Health, but if one of the board members wants to join her, that would be great. You know, if anybody's available, I can let her know that you'll be there. So, yeah, do you want,
What about the MRC?
the MRC, well, we were told one table, so I don't know, I didn't ask them about, you know, having two tables. We could have some MRC information. It's Nikki, I think, that does it. I could ask
Yeah.
her if we can have an additional table for the MRC. I'm sure we could get some volunteers who would be willing to go and present information. Yeah, I didn't,
What
she
is the
didn't
date on that
specifically say the
again?
MRC.
I
But
forget.
I can ask her about that. Did
I'm
they go
just
last
thinking,
year?
We have so much material, even in the material in the hallway we could use of the Board of Health office, the nurses.
Oh, yeah.
I mean, we could have
And
three
and all the
tables.
programs that we do. The
So-
matter of balance, the falls
Well,
assessment.
I mean, we have so much to offer.
There's a lot to share.
A lot to share, and, you know, giving just a 11 flu vaccine is a big deal, because they can answer questions. But we have so much what we do, other than just a small nursing office, that I think we should really ask for a second or third table.
I can do that. Did they MRC go last year?
I don't remember. I don't think
You
so.
went last year.
I was away.
Yeah.
last year.
No,
I
they-
did not go.
Did you have an MRC table?
We did.
You did, okay, well, I'll reach out to her about the MRC, get an additional.
And then what about all the other things we give away and whatever?
Well, we're gonna present as much information as we can, you know, to people. I think we'll use some of the stuff that Mike used last year, you know, and,
Which was excellent.
yeah. And
Great.
Sandy will bring all that stuff
I
over,
It's a good idea.
Thank you.
yeah.
Oh, it's on the 14th,
14th.
January
January.
14th, yeah. Anyone have any other comments, questions, or?
I do not.
Are we meeting on the 22nd? Are we meeting on the 22nd?
We'll see if there's anything on the agenda.
Right now, I have nothing.
And don't you need 2 weeks anyways to put it in?
We do it the Wednesday before the meeting.
Okay. Why did I think you needed 2 weeks? To post?
2 days.
Wow, I thought it was 2 weeks. All right.
Okay, so regardless, can we close out the Director of Public Health reports?
I make
I
a
need a
motion
motion.
that we approve the Director of Public Health.
And all the other reports too.
which
And all the
includes yes, which
accompanying
includes all the
reports,
others.
And I'll
Good.
second.
which includes all the others. Thank you. All in favor?
Aye.
Aye.
So,
So-
waiting till the Wednesday before, is that what you're
So
saying?
do you want to cancel the next meeting if there's nothing on the agenda now, or should we wait on that?
I think you should probably wait.
Okay,
yeah.
just in case something
Yeah,
comes.
I'll let you
Okay.
know,
Okay,
the Wednesday.
okay, that sounds great. So I guess we need a motion to end the meeting.
So moved. Make
Second by Marwa. All in favor? Aye.
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 Good night. Happy holidays. You never know what's going to happen.